I'm Dr. Charles Bauer, and I'm an interventional radiologist here at Goshen. I work in the main hospital and in the Heart and Vascular Center. My undergraduate, I went to the University of Akron in Akron, Ohio. Following that, I went to medical school at St. Louis University in St. Louis, Missouri. And then I did my residency, which was a slightly prolonged path. I started out actually in orthopedic surgery, so I did 1 year of general surgery training and 1 year of orthopedic surgery training. And after that, I decided to switch to radiology. So I did my radiology residency all at the University of Illinois. Following that, I was hired by the practice where I trained to do interventional radiology. When I switched into radiology, I didn't know what specifically I wanted to do. I'd always liked the specialty and the fact that you can do things with a minimally invasive technique and minimal impact on the patient otherwise from your procedure. We also do interventional oncology, so multiple treatments for cancer patients, some of them including the more mundane but important procedures of obtaining biopsies for tissue diagnosis and obtaining vascular access, but then also treatment procedures as well, including radioembolization and tumor ablations. We work collaboratively at the Heart and Vascular Center with our entire team on that to come up with the best treatment plan for the patient. We also work closely with the Cancer Center, and so together we can decide what the best treatment modality, either combined or separately, are for that patient. Sometimes we'll help out as an adjunct to other procedures, for example, thoracenteses and paracenteses, which for us are relatively simple procedures, but there's something that has a major impact on the patient. We also do things like lumbar punctures, abscess drainages, dialysis access. So, and then we also do some pain management as well, including joint injections, joint aspirations, and epidural steroid injections. In addition to tumor embolizations, we also do embolizations for benign conditions, the most common being uterine fibroids, which we can offer a non-invasive or a minimally invasive treatment for uterine fibroids, where we basically inject small particles into the uterine arteries to cut off the blood supply to the fibroids and cause them to regress. But the procedure can be done generally either as a same-day procedure or with an overnight stay. Generally, we can do it transradially, so we basically just put a needle in through the patient's left wrist, and we can do the whole procedure from that approach. For small procedures such as thoracenteses, paracenteses, and lumbar punctures, and vascular access, we're generally happy to see the patient as a service without even necessarily having them seen them in advance. So the patient can just come in and have their minor procedure and be done afterwards. If there is a patient who has any issues with peripheral vascular disease, that be it claudication, even small wounds that aren't healing, or things like that, the best thing to do is to make a referral to Heart and Vascular. And regardless of whether you refer to us or to cardiology or to vascular surgery, because we all work collaboratively, then we'll collaboratively decide what the best approach is for them, so that we're potential one inroad for vascular disease management.